Have you had any patients recently with this flurona?
I have actually, and it's more prevalent than most people would think. But also, I just want to go back 1 hour. I had a very interesting conversation with a patient. She called the clinic earlier this morning, and she wanted us to call her in some antibiotics because she said she had some upper respiratory tract symptoms and a lot of coughing. We encouraged her to come on in and let us test to see what it is we're treating. Reluctantly, she came on in and we tested her, and she had the flu. Now, she tested negative for COVID, but after she was informed that she had the flu, she was very thankful that she came in because there's a whole different treatment for the flu as opposed to, say, some type of bacteria upper respiratory tract infection. We gave her the Tamiflu. We gave her some other treatments for a lot of the symptoms. But also she noted that she lived with her mother, who was in her late 70s and had a lot of chronic medical problems. And we were able to call her mother in some Tamiflu prophylactically, so she probably would not contract the flu or had a better chance of not contracting the flu. But the take home is, if you have symptoms and you just don't feel well, go ahead and get checked out, because it could be coronavirus, it could be the flu, it could be a common upper respiratory tract infection. But we need to get a handle on things, because right now a lot of infections are going around.
And Doc, are flu and COVID together more dangerous?
Yes, they are. And we've had quite a few of those patients as well that would come in and they have severe upper respiratory tract infections, some even having productive cough, some having early stage pneumonia. And basically what happens is your body is being attacked by two viruses at the same time, and your immune system is fighting against the coronavirus. Hopefully the person, that has this have been vaccinated, so they have a better chance, but you're also having to fight the flu at the same time. So if you're somebody that's a little older, maybe chronic medical conditions, you have a much better chance of getting severely ill. So it's just something that we really need to be aware of right now.
What are the symptoms of flurona, Dr. Quinn?
Right, flurona, that's that individual that has coronavirus and the flu at the same time. Typically, these patients will present more sick than those that might have only coronavirus and or only the flu. So these patients will come in and usually they'll complain of a higher fever, a productive cough where they're coughing up a sputum, just a lot of fatigue, a lot of body aches. I mean, I jokingly told a patient that had both at the same time just 2 days ago. I said, it's like you're getting beat up by two big old guys. But the good news is, at this point in the pandemic, even though we have a surge of coronavirus coming back and now we're dealing with the flu, we have more treatments. We have the Paxlovid, where we can really fight back at that coronavirus. We still have our Tamiflu, and then we have all our symptomatic treatments. But the take home I want everybody to remember is, if you're not feeling well, go ahead and contact your medical provider so you can be tested for everything. Now, you can do a home coronavirus test, but unfortunately, right now, the flu test is not available in the drugstore, so you might have to go to your medical provider's office. But go ahead and get tested, because if you have the flu or coronavirus, there's a whole different treatment than just a typical upper respiratory tract infection.
And Doc, how common is flurona right now?
Well, right now, as I said before, it's very common. I mean, it's much more common than we would like it to be, of course. And a lot of this is because we're coming off of those restrictions. I mean, the CDC, they just decreased a lot of restrictions. A lot of times we're not wearing the mask anymore. Kids are getting back in school. They're around each other. And remember, a lot of our kids serve as carriers, because in a lot of cases, they might not have a lot of symptoms, especially our teenage students that are more strong as far as their immune system, but they bring it home to the parents, and we're just getting out and about. So it's very prevalent right now, so we just need to be on the lookout.
All right, Dr. Quinn, thank you so much, as always, for being with us and shedding light on this. The flurona, now we need to be on the lookout. You could have both at the same time, or you could have one or the other. Both of them need to be checked out then.